You're listening to the Pace Radio Network here at paceradio.net.
The views expressed by the individuals during this broadcast are their own opinions, and they may not be the same as those of their group or other organizations they may be involved with.
All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
Hello, everyone, and welcome to V.A.C. Roundtable number 71. We're very honored to have a pioneering physician, Dr. Frank Lucido, who has been out on this spear early on, which is literally 20, almost 30 years ago, with what he had done with Proposition 215 and our dear friend Dr. Todd Mikaria. And unfortunately, we lost Dr. Todd a few years back. And to have people who were part of the history as it was there and as it happened is important to us. We believe it is important history. It was early on when the internet was really just starting out. And yeah, so basically, can't thank you enough for joining us today, Dr. Lucido, and basically go into our first question, which is, how did you originally come to cannabis? Now, this is kind of a multi-pronged question. When were you first turned on? When did you, yeah, go for it.
All right. Well, so I started college in September 1966 at Michigan. And I was one of the more cautious ones. I didn't smoke pot until I saw what happened to my friends and all that. And by January of 67, my second semester, I realized that people were having fun with it and nobody was having troubles with it. And so that's when I first turned on. And I'd heard the rumors that you don't necessarily notice much the first time. And sure enough, I didn't notice much. We're sitting in a friend's attic, where he happened to live. And then we decided to take a walk down the street to the local grocery store. And it looked like it was about, 2 blocks away. And as we walked there and approached, seemed to be getting a half a block away. And all of a sudden, it looked like we were 2 blocks away again, like time, the space really expanded. That was the first experience of being altered that I realized. And I thought, well, this is interesting. And we had a good time laughing and a number of other things. And I was sold on it then that, I found out soon that it really didn't harm anything. And by that time, I'd already been through 1 semester of college, and I realized a lot of the weekends I felt I had quite a bit of a hangover because alcohol was available, even though we were 19 and 20 and 18 years old. So I realized cannabis was so much safer than alcohol. And not that I've been a teetotaler. I mean, I'll have the occasional drink, but for people that really can't drink at all, it's great alternate. And for those that want to stop drinking, it's been very helpful for a lot of people to stop drinking. So anyway, that was my first experience. And by 1974, I finished medical school and I moved to California. And I was in an apartment in San Francisco, and I had some seeds and I just planted them in a little flower bed. And so I had two flower pots, and I had a plant on each one, and they didn't get much sun, but I had a morning exposure, and they got just big enough that I saw that one had little tufts going this way and the other one had little bells that came down and then opened up and a little powder fell out. And I thought, oh my God, there's pollen, there's the male one, and the other one must be a female. So, but again, there wasn't, I think I smoked the leaf and it didn't do anything, but I had access to buying a lid every once in a while. And probably in 1977, I'd say is the next time I grew any. I lived in Martinez, which is where the Christian Brothers grew their grapes for the first wineries that they had. And so they had plenty of sun, and I had a southern exposure backyard in this housing division, and germinated six seeds. Six plants came up, and as I grew, I recognized one was male, and I sacrificed that right away. Took it inside to get it away from the others, and I had a nice pound of sensimilla out of the other 5 plants. And I did an interesting thing with the one plant that was male, and my girlfriend at that time was studying Indian dance. And when you study Indian dance, you cook for your teachers, and there was a book called Flavors of India, and one, it's just a regular straight cookbook, but in the back were their beverages, and one was making bhang, Bhang, and it's a drink that they would make at the Shiva festival and drink and have their experiences and praise the Lord, etc. And so we made bhang, and even though there wasn't much, I know there was not much THC in it, about the same time that I was getting a little bit high, I would also get a stomach ache. And finally, I realized it was the male plant that was causing the problem for me, because as I was stripping the plant, I realized my nose was running, my eyes were running, and I touched my eye because it was running, and my eye puffed up, and I realized, oh, I'm allergic to the male pollen. So I wrote that up in a little study about some people are allergic to the male pollen, but the female plant never bothered me, and to this day, it's really not a problem if you got really good sensimilla. So that was a couple of my experiences. 1977 was the first time I ever grew, and then I didn't really grow again until just before, let's see if I wrote that down. Yeah, I grew a few plants in my backyard about 8 years ago, and again, I got about 5 plants, and I got a nice pound of sticky bud out of those because none of them were males. And then the only other time I did it was the beginning of quarantine, and I had plenty of time, so I grew some plants out in the backyard. But as you might remember, that was the year of the fires. So the fires in Sonoma County, the sky was, even on a clear day, was like beautiful red. And then I realized, oh, that was like all the smog from burning houses and burning pets and stuff from Santa Rosa. And then it all dropped down onto all the ground. And I realized I never felt good about that particular batch because it, I'm sure it had stuff on it. Plus I'd made a mistake of leaving the backlights on. So instead of having a natural shorter days, I messed up the light cycle. So that was my experiences of growing. I had one great grow and a couple, one experimental, one great grow, and one failure. Actually, two good grows and a failure. But I like to leave it to the professionals to do it. And if I really had more time and more space, I'd probably, it was really fun and rewarding to grow your own plants. So that's, how I originally came to cannabis, and a little brief story of, and nowadays I really prefer edibles just because I cough a lot more. And when I smoke, and I really like edibles now that you can get edibles that are 5 milligrams or 10 milligrams, because edibles before, when people made brownies, it was just so hit and miss how much was in there that I didn't feel good when I overdosed, and I would get the whirlies about the same time as I was getting high. So I like edibles now that I know 5 milligrams, I know 10 milligrams. I'll even occasionally do 15, but 10 is just about right for me. So that's my experience there.
Well, thank you. That's a fascinating journey through there. I didn't realize quite a few of that there. Yeah. All right, next up will be Council Member Landau. Nate, you're up with the next question for Dr. Lucido.
First of all, as a young advocate, I want to thank you for your decades of work. I look up to you and admire you, so thank you so much for all your pioneering. And
Oh, you're welcome.
my question is, how has your experience as a family general medicine practitioner influenced your approach to medical cannabis evaluations for veterans? Thank you.
All right. Well, so I started my practice. I just retired after 41 years, but I started my Berkeley practice in 1979. And before the Compassionate Use Act, Prop 215, I had met a couple of the principals. You know, I'd met Dr. Todd Micarea and Chris Conrad through other, well, I met Chris Conrad through my anti-nuclear friends, and because I was an anti-nuclear activist. And then he told me, oh, there's a benefit for Prop 215 and at his house, and Dr. Todd Micarea was there, and I'd heard of him before. He was like a hero of mine, even though I'd never really met him before. I knew he'd published, you know, a decade or two before the marijuana medical papers, and which was a compilation of all the literature from, you know, the 1800s till now, some of the seminal pieces. So Chris Conrad says, oh, you want to meet Dr. Todd Micarea? I says, I'd love to. And we'd had a patient in common before. I had a nursing home patient that was dwindling and wasn't eating. And the head nurse said, oh, you know, you might want to get a psych consult. And Dr. Micarea is on for psych. And I'd heard of Dr. Micarea, like I said, had not met him yet. And he recommended Marinol to this patient because this was long before Prop 215. And I'd heard about Marinol, but I didn't know any doctors that would dare prescribe it. And sure enough, he'd prescribed it. And this woman who's elderly and depressed and wasn't eating, her mood picks up and she's starting to eat. And so it was just great. And we just charted notes. So we hadn't really met, but we'd met each other by, you know, writing notes in the patient's chart. So flash forward now again to 1996, Prop 215. We're trying to get it on the ballot. And there's this fundraiser at Chris Conrad's house. And he says, oh, Dr. Micarea's here. Do you want to meet him? And I said, oh, I'd love to. And we meet, and I introduced myself, and I said, you know, we had this patient in common. I've been wanting to meet you with this patient in common, and told him about the woman who was dwindling away. And as soon as he prescribed Marinol, she's starting to eat. And he says, oh, that's great. Want to smoke some hash oil? And I thought, sweet, yes. So I thought this stated older gentleman, you know, who was probably my age then, he was probably in the 70s, and I'm 76 now. I thought I'd have to be a little bit more circumspect, but he invites me up to smoke some hash oil. And so that was my first experience of, you know, real concentrate. I mean, I'd had hash before, but like this was something really cool. So we became fast friends, and because there weren't a lot of doctors that were well, again, it was before Prop 215. So let's see if there was anything more to that question, because we'll get in more stuff. I think that's the main thing I wanted to say on that one. Yeah.
Again, thank you for that.
Sure.
I miss him so much because he was such a character on top
Yeah.
of that, but he was also so wise, so understanding. But yeah, no one was quite like him for sure. Next up will be Council Member Wade Laughter. Council Member Laughter, we recognize.
Yeah, thank you, Jen. And thank you, Dr. Lucido, for joining us this afternoon. Full disclosure, Dr. Lucido was my recommending physician for, I don't know, maybe a dozen years. I felt like I felt like you were a friend to me.
Absolutely.
And I really, deep gratitude for knowing you. And it's a real treat to have you here this afternoon. So my question for you, given all of that I wanted to say first, you were co-author of an article, Implementation of the Compassionate Use Act in a Family Medical Practice, 7 years clinical experience. And would you talk a bit about what key insights or recommendations you would give to physicians who are not as familiar with cannabis as you are and may feel hesitant about recommending medical cannabis to their patients? Thank you, Doctor.
Sure. Well, that sort of dates that was 7 years after Prop 215 started. So now it's been 25 years, 26 years experience. The main things that I found among patients, that it was a safe and effective medicine. People weren't having problems with it. There were no deaths. So it was the safest medicine that we know. I mean, not only did the literature show that, but that was my personal experience from, seeing hundreds of patients, thousands by now. And it's even better now because we have more choices with less intoxicating forms when necessary, especially for kids and inexperienced patients. And talking in one of the specialties, even as adult use became the law, so a lot of patients no longer had to come and get recommendations, which is great. I'm glad I was a proponent of medical adult use, but it didn't cover minors, and so a lot of the people that I was seeing were either elders or inexperienced people that needed some guidance about what to use, but also kids. I started seeing a number of kids with seizures and autism and a number of other things, but that was probably the 80% of the kids that I saw. And I probably saw, 300 or 400 kids ultimately. And for the kids, I would see them, every 4 months or so, just to see how they're doing. And it was really good by that time that you could get tinctures that were, 50-50 CBD to THC, or 8-to-1 CBD to THC. And for some of them, you needed more THC, and for others, you didn't. So for seizures, for instance, really CBD seemed to do it, and you could really bump the CBD up high without intoxicating the kids. And sometimes you needed a little THC if the autism spectrum also had a little self-injurious behavior or aggression against their parents or their teachers. So little THC was very helpful in that case. So those were some of the things that I knew. And let's see. Yeah, and then I think one other thing I wanted to point out that would have, I really wish that, my mother died a few years ago, and she had always said that she'd use cannabis if it was legal. And when she visited me, soon after it became legal here, I said, remember you said you'd, use it if it was legal. And she still hemmed and hawed, and she didn't want to really try it then. But as she got older and had a lot more medical problems and a little bit depressed, I would bring my vaporizer to Michigan with me, and we, adult use was had started, but they really didn't have tinctures. In fact, this was probably even before adult use. It was certainly before. Yeah, medical had just passed in Michigan, but the dispensaries really didn't have tinctures and things like that yet. And so with my mom, we did try the vaporizer, and she couldn't really get enough in. And my best friend and I would be, smoking in front of her or vaporizing in front of her, and we'd be laughing, and she'd say, I want what you have, meaning she wanted to feel stoned and happy. And a couple times we came close to that. We were able to find a friend of mine who would make edibles, and sometimes she would, do okay on them, but, she had other problems where she'd want to take sleeping pills even in the daytimes just because she had depression. So I'm sad that we didn't have the edibles that we have now, where we could really know the dose, and I could have maybe tried her on a 50-50 for a while and then bumped it up. So I'm just so glad for where we're at now for patients that are new. but didn't come quite in time for mom, and she eventually died from a number of other complications. But I wish I could. I think once or twice she actually got some joy from it, but she would take it, inappropriately, and left some in the refrigerator. Then my stepfather took it thinking that it was just a brownie, and then he ends up going to the emergency room. So it was a little bit of a mess, but so that's some of my personal experiences there. But nowadays, I'm really glad that you can get the dosing you want and the proportions you want.
I agree completely with your observations about how nice it is to have products that are accurate, so dosing is consistent. And I think every person who makes products with cannabis has a story, just like what you told about your, I think you said brother-in-law, who ended up having something that was unintended. So yeah, here we are.
Yeah.
All right. Well, thank you for that. Next up will be Councilmember Michael Crowitz. Councilmember Crowitz.
Yeah, the demographics are a little askew here. I don't think you have written recommendations for half of the veterans community, just half of the veterans randomly sampled by Veterans Action Council tonight. But that's pretty awesome. I love the fact that you're sort of woven through our lives. My recommendation in California, I had already had a doctor's prescription from the Netherlands. And if you remember, that was in total contrast with what the Department of Veterans Affairs was saying to me, which they were saying, hey, if you'll stay away from marijuana, we'll give you any pill in our pharmacy. And then, of course, the doctor in the Netherlands was saying, hey, first of all, take it as a tea, take as much as you want, and I'll write a prescription for as much cannabis as you want if you can actually put aside those darn pain pills. So, I mean, you couldn't get more contrast between the two doctors' advice. And I actually already had a cannabis card because Dennis Peron's club allowed me to get a club card with an international prescription and a driver's license from Virginia, which later became a little bit more difficult at the dispensaries in California. But yeah, my own prehistory there, just for, I guess, my own disclaimer. But much love and thank you for joining us. My question really was about the work that you've done with and within the medical board and the medical community. The question was, please talk about the challenges from the California Medical Board that you and Dr. Todd's early work around medical cannabis, and are there any doctors with cannabis experience in the on the medical board? I guess I would expand that question just to ask, where are we at with the medical board and doctors recommending cannabis?
That's a good question. Since I've since the adult use happened, it didn't just happen. People worked hard to get that, obviously. I haven't paid as much attention to what's going on with the medical board. The doctors that are getting trouble with the medical board are fewer and farther in between. But, probably once you had adult use happening, then which only covered 21 and up. So you had this whole section of quote adults that are 18 to 21, right? And so I think the cannabis doctors, I mean, I already had my niche because I was seeing a lot of kids and a lot of elderly patients that needed advice. But whoever was running the mills before, and I use that derogatorily, like those that were just going to see anybody and the ones that gave it a bad name, they're the ones that ended up with nothing but the 18 to 21-year-olds. And so they're the ones that would stick up more like a sore thumb, because even though the 18 to 21-year-olds could very well be, needing it medically, a lot of them were kids who were hiding it from the parents. And that's a recipe for disaster as far as not harm to the patient, but like when the patients find when the parents find out, they're going to be very mad at the doctor. So those are the ones that are probably getting the doctors reported to the medical board. So, when I was a co-proponent of the Repeal Cannabis Prohibition Act of 2012 that we were trying to get on the ballot, and there were 3 competing initiatives, so none of them had enough funding to get on the ballot. You know, the one contribution I made to it is I said, make it 19 the age instead of 21 or 18, because then you're at least keeping it out of high school, but you're also acknowledging that you don't have to be 21. So, and people thought that was weird, and but like it made sense, but ultimately that's not what happened. And when it finally happened that we had adult use, they made it 21. So it doesn't help all adults. But that's the main thing, I think, is that you don't have as much of the parents complaining about it because their kids are using pot when they didn't know it. Let's see, was there more to that question?
Just if you felt like reflecting on, what it was like, what some of the challenges were, with Dr. Todd,
Oh yeah,
facing down I remember a moment where the drug czar, I guess they called him still at that time, General McCaffrey, was standing there with a poster board of some of the indications that Dr. Todd had, written on the poster board, and
Oh, yeah.
saying he called it Cheech and Chong medicine. And he was quite sure that he was going to just get rid of that he was going to use the DEA's power to just get rid of all the doctors that write recommendations. And that would be the end of that. Medical marijuana, done.
Yes,
yeah.
please.
Yeah, I remember that yeah, the drug czar came out, and this was, what year was that? Because Dennis Peron's club had already opened, but this was before Prop 215, right?
It was
Yeah,
it was after Prop. Was it after? I thought it was after Prop 215, but before. So it's like 1999 or 98 or somewhere
Okay,
around
yeah.
there.
Yeah, so because I was remembering something before where it was Dennis Peron's club went from the small club to the big one, but that was before Prop 215 passed, because I remember being at that club when it first opened early in 96, and then I was there on the night of the election. And so that was a happy time. So we're celebrating. So this is still not answering your question, but I'm still now on the day of it passing. We're seeing it as the elections are coming up. Clinton is getting reelected, and then Prop 215 goes over the is finally it's projected that that's going to win. And Dennis Peron, and I didn't know him well, but I knew him enough that he would always say, Frank, you got to crank those prescriptions out. You got to crank those recommendations out. And I was doing it my way, and there were people that were getting in more trouble by doing it his way, just by writing it for anybody. And at one point, there was a celebratory joint happening on the stairwell of this 5-story club that he had, and I was about to take a toke, and somebody yells up, Dennis, the press is here. And I thought, oh, okay, I'm not going to have my first, be photographed with smoking a joint. And the next day I got my first interview by the press, and I realized, oh, I've got to get better at being able to talk about cannabis. So I, got my talks going and stuff like that about that, because before that, I might have been quoted once or twice. I think I had a letter to the editor, published in the Chronicle, but I was still, not as out as that day was my first interview. Again, getting back to your question, then McCaffrey starts going in and saying that this again under Clinton, right? He was the drug czar, and he started threatening doctors, and yeah, the graphic you pointed out, he's there with his press conference showing people are using it for this and this, and here's Dr. Todd Mikaria, his name was like, he was right out there, which Todd didn't mind, but it was like, it was a lesson, if doctors are going to be named, and as time went on, I did get investigated by the medical board when they were investigating 12 of the 20 most outspoken doctors. And Dr. Todd and I and others, Fred Gardner, who was a journalist and started O'Shaughnessy's with Dr. Todd, the Journal of Society of Cannabis Clinicians, which back then was called California Cannabis Research Medical Group. And Yeah, so we started going to the medical board testifying about doctors being inappropriately investigated. And finally, one of the medical, the medical board, we would go to these public comment periods. And at first it wasn't necessary. Well, it would usually often be on the agenda, but even if it wasn't on the agenda, we could bring it up in the public comment period. And usually the medical board is under the Attorney General's office. So even though it's about medical standards, it's really still part of law enforcement. And so you'd always have somebody from the Attorney General's office, trying to like badmouth what we're doing. And at one point, I didn't know who was in their favor up at the medical board, right? Because there was, 2/3 are doctors, and there's about 10 people on the medical board, and about a third of them are lay people. And one of the guys who was a lay person wasn't the medical board president at that time, but within a year, he became the medical board president. And he stops me during my public comment period, and he says, "Wait a minute, Dr. Lucido, I'm sorry, I have to interrupt you, but like this happens every time. This is about the 5th time we'd gone there, Dr. Todd and I and others." And he says, "This happens every time. These people," meaning us, the doctors, "get up and talk, and you people, the Attorney General's office and staff, are sitting in the back, smirking, giggling, and generally acting, not giggling, but smirking and generally acting disrespectful. And I have to ask why. My father died of cancer, and I'm sure that he never used cannabis. Well, I never used cannabis, but I think it would have helped him at that point. And so we knew that we had somebody on our side there. At that point, we didn't know who were our allies or not. So we knew we had at least one ally, and it turns out that probably half of them were very, positive, but nobody wanted to speak up until this happened. And like I said, later on, he became the president of the medical board. And so again, is there more to the question? Because I sometimes I get off on what I think is the question, but then it gets off into a tangent.
I think you got it there. I think you nailed it.
Yeah.
It's a snapshot in history that y'all were it was very pressing early on because it was going to have its reflection on other states and their access as they came on board. So for you selective few to stand your ground, but then you were forced to be doctor activists on top of being medical cannabis activists, you had to then go on defending each other amongst your own board, which is a whole other set of challenges and bravery. I mean, that's a significant amount of bravery to go against the system that can literally bite your hand and it feeds you. So it's a challenge in itself. Councilmember Laughter has a follow-up.
Yeah, not so much a follow-up, just an expression of gratitude, Dr. Frank, because I think, I don't know the time frame of when this was happening, but I think I was a patient of yours when the medical board was considering revoking your license because you were taking care of people like me. And anyway, hero, I think, is a good word for you. Thank you. That's all I have.
I can say something about when I got I forgot to mention, I got investigated by the medical board. And I think that happened before I started going to medical board. That sort of was my impetus to get the group together of all the doctors I knew and some attorneys also. And
you were talking about being investigated by the medical board.
Yeah. Yep. So they finally they finally closed my investigation, but there was something else I was going to say about, and it'll probably come up in a minute as soon as I think about something else. But
yeah, because your precedent set so other doctors could also be brave, and to also it had to be reassuring for those doctors to see you in the gallery when they were up regarding their situation, because again they had to look to you two as early pioneers, but also supporters as well as doctor activists. And again, I'm humbled because I'm again one of those patients as well that you helped take care of after Todd was my original physician, and then unfortunately at his time, then I came to meet and know you. And needless to say, it's been nothing but an honor to watch your growth and see you stand your ground and become a light of hope to other doctors in a time when I know it had to send a ripple across many doctors' lives, because they were either considering looking at cannabis, but also just protecting that confidentiality between, patient and doctor, which was very much most important.
Yeah, thanks. I remember now, one of the things I want to say too, the reason I got investigated by the medical board was for one of the few minors. Later on, I became a specialist in minors because I saw so many these kids with autism spectrum and seizures. But I got investigated early on because of this one 15-year-old who had already had problems with truancy, and he had pretty severe ADHD, but really, well, not basically he was in school in a special ed class, and one thing he started doing was hanging out with people that would get him into more trouble, and some of his quote bad friends turned him on to pot. And this is according to his mom. Once he started using pot, he became calmer, his grades got better, and his teacher would give a report to his mother that he's sort of a model student. I made him president of the special ed class because he was helping other kids with their homework. So I realized, yeah, this is that was one of the few minors that I wrote the recommendation for, and that's the one that he had a parole officer, not wasn't really parole back then, whatever minors get, the home visit lady found a pipe and violated his parole because of using pot. And then when the mother said, well, he's got a recommendation for it, she quotes that this guy said, oh, what Dr. Lucido's doing is illegal. And then I got that investigation, and that's why. And when they wanted me to come in for the quote voluntary interview to discuss it, and that freaked me out. But I got an attorney, and his advice was, oh, you just don't go in for the voluntary interview. And I didn't, and they finally, dropped the case because they really had no evidence of anything. In fact, that's what they said. We decided to close the investigation for lack of evidence. And, I thought I always look at that smirkingly, because evidence of what? Because it was not even what I was alleged to do wasn't even illegal. So anyway, that was very nerve-wracking, and that's why I got together the group of the attorney physician cannabis medical legal group. I called it AppCamel back then. And then that's when we started going to the medical board quarterly meetings. Steph Shearer from Americans for Safe Access, which was a new organization at that time, joined some of our meetings and went to the first meeting. And then Dr. Todd and I and Fred Gardner were the ones that continued to going on a regular basis. Jeff Hergen, rather, of course, was, also involved, and a few others. Yeah. So.
Councilmember Laughter.
I can't help it. I just one of the things it occurs to me to say to you, Dr. Frank, is you're talking to people who are veterans of military service. And part of that often calls upon you to do things that are scary, and maybe you're afraid, but you do them anyway. And that's a form of heroism, a form of bravery, a form of responsibility to one's community. And in addition to all of the work that you did to become a doctor, to take on this additional level of work and responsibility for caring for your patients in, going against the establishment. That's a form of bravery that they don't give medals for it. But you have patients like me who have deep gratitude for the opportunity to have known you and to have experienced your form of compassionate, informed care. So thank you.
Oh, you're welcome. Thank
Yeah.
you.
Testify, my brother Wade. Testify, testify, testify.
You're listening to the Pace Radio Network here at paceradio.net.
Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit, or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further, as they have professional grow lighting. They have indoor grow systems that are easy and cost effective, with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
Are you looking to get your medical cannabis grow license? Limestone City Hydroponics can help patients through the process of obtaining their license to grow medical cannabis. What's that? You don't have a doctor. If you meet the medical criteria, Limestone City Hydroponics has a nurse practitioner who can assess and provide medical cannabis prescriptions. What are you waiting for? Contact Limestone City Hydroponics at limestonecityhydroponics.ca or call them at 613-548-0420.
What do you find at paceradio.net? People advocating cannabis education.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
Cannabis edibles are an effective way to manage pain and other ailments, especially when you deal with your trusted partner, Legacy 420, in Tyendinaga Mohawk territory. You see, we lab test every product on site to ensure proper dosage every time, which is critical when consuming cannabis edibles. All Legacy 420 edibles are made by our classically trained baker and chocolatier, and we also have super tasty vegan options.
Our baker has been in the industry for 25 years. She's also a chocolatier. Everything from savory to sweet, your chocolate bars, brownies, butter tarts, you name it, we make it.
Talk to our knowledgeable Cannatex about our incredible variety available. Give your trusted partners a call. Legacy 420 out on your road.
You're listening to the Pace Radio Network here at paceradio.net.
Sister Peggy Jones, council member, you're recognized for our next question.
Thank you. And thank you, Dr. Frank, for joining us this evening. If cannabis were legal, do we currently have the appropriate medical coding and billing for insurance companies to cover it, or any herbal medicine? If not, how would you suggest we go about getting medical coverage changed so those seeking a holistic herbal therapy have equal access, even with insurance?
That's a great question. I really wish this would happen. I think the main thing is, though, I've been in medicine for, like I said, I just retired after 43 years in family medicine, and I guess it was 41 years in family medicine, because I retired from that 2 years ago, but then I continued the cannabis practice till September. So what I wrote here, let me just see. So this is a financial issue for many. This has been a financial and will be a financial issue for a while, but it's always worth pursuing. I predicted early on that if insurance companies had to pay for it, they would be the ones to push to make it an over-the-counter drug, because insurance companies don't pay for over-the-counter drugs. So I don't know that we're ever going to get to the point where they're going to pay for it, but if we keep pushing for it, maybe it will go for a national, okay, let's make it an over-the-counter drug and force the insurance companies to be our allies then. I mean, it'd be great if they paid for it, but it'd be great if they paid for healthy food too. And it'd be great if they, safe housing. There's a lot of things that would be good for our health, but clearly medical cannabis is medical. So that's the one that's most obvious, but that's how they get out of it, by making it an over-the-counter medicine. And we're not quite to that place, but I think in many states it is. So ultimately, I think that pushing for them to pay for it is worth pursuing, but I think that's going to be their way out of it, is by saying, well, let's make it an over-the-counter medicine, which would also be the next best thing. But yeah, it can be very, I guess maybe in California, I'm feeling like it's not that expensive nowadays, but that's not the case in other states, and some states it's just not available. So just because we're okay doesn't mean other people, can afford to pay for it. So yeah, I'm not sure the answer to that question, but that's some of the issues involved.
All right. So next up will be Council Member Mike Davis for our next question.
Yeah. So a significant and important part of your work was to defend the integrity of the medical profession by establishing and enforcing medical standards of conduct. Are we doing better or worse in this regard since the emergence of adult recreation regulations and the associated reduction in medical cannabis patient numbers?
All right. Well, my intention was to make sure that doctors with good standards were not being inappropriately being investigated by the medical board. So with adult use, 21 and over, we've mostly done that. I was a co-proponent, and I mentioned this earlier, I was a co-proponent of the Repeal Cannabis Prohibition Act of 2012, which did not get on the ballot. Our initiative set the age adult use at 19 to keep it out of high school, where some kids might be inappropriately sharing their cannabis. So I think that's the main answer I have. Let's see. Yeah, is there anything more to that question that we want to delve into? Because that's what I wrote down, but I could open that to questions too.
Well, I guess it's we know that there was some change in California with there was 64 and Proposition 215 sunsetting. We know there was sort of there's still outstanding questions such as how much a patient can have, because by Proposition 64 standards, I know that there is limits to concentrates, as well as how much people can have per day, etc., for purchasing. So wasn't sure of the crossover there, or if there is any crossover. I know there was some legal standing prior, because doctors could write for whatever you have, because there's different different humans have different needs, right? And different conditions have different needs as well. So I was kind of curious if there has been any change in standing, or do the pre-215 laws still stay in place for how much a patient can have, etc., or have that been nullified by the 64, in your opinion?
Yeah, that's a good question. And I'm not sure of the answer, but as you're pointing out, Prop 215 did not say an amount. It said that patients could grow, possess, use for personal medical use. And a lot of people, I wasn't involved in the writing of it. I'm not one of the 6, like Dr. Todd, of the people that wrote it. But hearing from it, that was like a big controversial point. It's like, well, are we going to get away with not putting an amount? And somebody, I can't remember if it was Dr. Todd, insisted on keeping it in there. And, when it was written, we didn't even have the funding to get it on the ballot. So even our funders might have said, oh, that's never going to pass. Why am I going to give you $100,000 or whatever? And yet it got on the ballot and it passed. So if you just look at Prop 215, it does not say an amount. It says personal, the amount for medical, the amount the patient needs. You can grow and possess and use for medical use. And then I don't know whether, the other ones, would you mention?
Prop 64, which is the adult rec.
Yeah, I don't know. I'm not sure that Prop 64. No, I mean, first of all, I know that the CCUA, the Prop 215 still exists. I don't know if and even that, different jurisdictions were saying different amounts. So somehow they're getting away with different jurisdictions. And I don't know if that's because of 64 or whether that was even happening beforehand. So I don't know the answer to that, but I know that Prop 215 did not state an amount. And that was intentional on the part of some of the people, and could have been a poison pill that might not have ever let it get on the ballot or pass, but it passed anyway. And I know that the people, one thing I know, I don't know a lot about initiatives, but one of the things is an initiative that the people vote on cannot be changed by the legislature. So somebody that knows a little bit more about how the SB 64 and all those other things work might have a better idea of, well, is that still the case? That, or is this an exception for some reason? And is it an exception within different cities? Because that's where the whole thing was. If you might recall, Oakland at first, some places were, Berkeley said 10 plants, Oakland said 144 plants, 2/3 of which could be, or 1/3 could be mature, I think. 2/3 could be immature, with the idea that maybe half of them wouldn't make it. So you really had this 144 plant limit. But then 64, I don't know the answer to that. I don't know if 215, because it's an initiative of the people and, you can't change that. Why they could limit it now.
Okay, just curious. Councilmember Laughter has a follow-up.
Yeah. One of the changes that I've seen, at least, I live in the Sierra foothills now, Dr. Frank. That's why you don't see me very often. And the local physician's office that I have been seeing for my referral is closing because they don't have enough patients to sustain a practice and an office. And I'm wondering, I know you've retired. I know there's probably still hot docs, as they're referred to, where, for $40 you can go online and you can get a recommendation and all that. But the doctors who are actually providing care and guidance, like you did with me, are those folks surviving with the changes in the law? What's your sense of that?
Excuse me. What was that question again? I mean, I can tell you a couple of doctors, like Dr. Hergenrather is still doing them. I've referred the last few patients that I had to him, including the the minors. And trying to remember Dr. Mikaria's sister is still practicing. She took over the practice in Cool, which was Molly Fry's practice, after she, lost her license. So those are the last two that I was referring, the ones that I referred the rest of my adult patients to, and the kids would go to, because I know Dr. Mikaria wasn't seeing the kids. So, yeah, I think that there's fewer doctors doing it, and I'm talking about the ones that, like me, that actually had good standards, et cetera. I'm sure that there's still, I don't know how those doctors are doing. They're probably doing, like you said, online recommendations, and maybe some of them have offices, but they got to be in the crosshairs of the medical board. But I haven't heard much.
Yeah, I think a lot of us in the cannabis industry are feeling the changes that have happened that don't seem very favorable. I'll leave it at that. And I can pose that last question, Etienne, if you want me to.
Go ahead, Wade.
So, Dr. Frank, in your opinion, what are the biggest challenges or barriers that veterans might face when accessing medical cannabis for their conditions as a result of their service? And I realize you probably don't have much experience with the VHA. We can certainly talk about that. But yeah, what's your sense of the challenges and barriers there?
Well, let's see. So I wrote something down. Let's see. I first thing I wrote is I guess I'd like to hear the veterans on this and see what the challenges have been, because I'm not hearing much about that. Again, like I said, it's been a year since almost a year since I retired. Maybe education on the various and best ways to use it, still needed. I know that I'm mostly using edibles myself nowadays. And because I know, it's easier to know just what 5 and 10 milligrams of THC will do, whereas it was hit and miss with someone else's homemade brownies before. And even with that, I had many good experiences with edibles, but I also had a number of uncomfortable experiences with it. So, any other, there's some of that I haven't answered. What are the biggest challenges?
Well, I like one of the topics that's been hot, if you will, in government policy around cannabis is the idea of rescheduling or perhaps even descheduling cannabis. And of course, that would have a lot of implications for many of us. But yeah, because we are a veterans organization, it's really our focus. And for the most part, yeah, the Veterans Health Administration is, in the past, they've been hostile. I mean, you can hear some horror stories from people in this meeting right now. But it seems like the stance has softened, at least in some of the medical centers. And I guess maybe I was hoping for a home run insight from you about how could we change it at the federal level? What might be the compelling argument to make it easier for veterans to have access to this product through the Veterans Health Administration, not have to go to a dispensary, have it be one of the bags of pills that they send you every month, that it be, precisely dosed edibles or a tincture that comes with instructions. Thank you.
Yeah. Excuse me, had a bronchitis lately, but I'm getting better. Yeah, so that is a problem, because you'd like the veterans. So your experience, you veterans have more experience than I have of how the VA is, but as you mentioned, and I've heard this before, sometimes they're quick to give medicines, quick to give you a whole bag of pills, or prescriptions for a whole bag of pills, but they're still, they were told a long time ago not to talk about cannabis. So it's almost like, are they even talking about Marinol? And I'm not saying Marinol is a great substitute, but like when I went to Italy last year, I knew I didn't want to travel with cannabis, and I knew that in Italy, even though cannabis is low priority, you really can't find it there. You can find CBD, but you really can't find cannabis very, very much. So I made sure to bring some Marinol. It's it's synthetic, but it still does what you want THC to do, even though I do believe natural is better. So yeah, I don't know. That's still a tough problem. But ultimately, I know that the VA would save lots of money by prescribing cannabis.
And veterans' lives, people who use cannabis for relief don't get to suicidal ideation very often.
Exactly.
That's my take on it.
Yeah, not only would you have less suicides, but then the side effects of these medicines can kill people.
Oh
No
yeah,
one is
and the
no one's ever died from
contraindications.
cannabis.
Yeah. I have one that's it's not necessarily a question that we have, but it's one through my experience and other veterans are finding out. And I'm not sure what your insight on this might be. 30 years ago, when I went to the VA, I was removed from various facilities just for mentioning the use of cannabis. That changed, fortunately, due to Michael Crowitz and others changing VA policy outright. So 30 years ago, when I went to the VA and I would mention my use, I was classified as a known drug user. Okay, so that was a terminology. And now recently we have seen an uptick in a new terminology called cannabis use disorder, called CUD. And unfortunately, any type of cannabis anything is basically being umbrellaed by this cannabis use disorder, which of course has become kind of the sexy name in cannabis for doctors and nurses to be throwing around. Do you have any insight on this or the harm this type of verbiage could be causing? Because it just seems to be a 80s throwback in terminology, or just as another way to demonize cannabis patients because of lack of knowledge potentially by the American Medical Association. Because I know that the American Medical Association is just recently, we know the Nurse Association and others have just recently only approved education or even that cannabis can be even a curricula for nurses to understand. So with this, we are seeing a large number of veterans who go to the VA and mention their use get labeled this kind of carte blanche cannabis use disorder. Have you heard about this? And if so, what are your thoughts, or how could we educate our doctors against this willful ignorance that they're seem to be pushing down on us?
Yeah, that's a good question, and I think it to me it seems malpractice on their part to be labeling somebody with that. So maybe somebody has to maybe it has to be some suits against the VA and some judgments against them, to make them pay attention, because that's a bullshit diagnosis. I even wonder about you're hearing about cannabis hyperemesis syndrome, which is
Yes.
real symptoms, at least. I mean, at least the alleged symptoms are there, and it could be due to other things. But cannabis use disorder, they're using just for people that use cannabis, right? So that's bullshit. So
Well, thank you for your succinct breakdown of that, doctor. I don't have many doctors who are that chef's kiss to the point, shall we say? But I think Peggy
Yeah.
has a follow-up on this.
Yes, sir. Thank you, Etienne. I actually do have a follow-up. With your experience with patients switching to cannabis, if they did not stop prescription medications that cannabis also helps with, say they have high blood pressure or they have ADHD or some other thing that cannabis helps with, if they don't stop that prescription drug, could it also mimic a cannabis disorder or allergic reaction of some sort, causing them to have side effects from the medication that they no longer need because they're on herbal medicine now?
there are very few things that cannabis is going to make worse. I mean, obviously, once you look at the intoxication, I mean, I've taken too much, edibles, as I mentioned. So yeah, you can get an overdose, but that's not what we're talking about. You're talking about people being labeled cannabis use disorder. So I think that that's just a misdiagnosis. That's a diagnosis of convenience to label anybody that's using it a use disorder. And from a legal standpoint, they could name it something else if they want. They could say it's illegal for you to use it on VA properties. They don't have to get into this pretending. That's pseudo-medicine, I think. And again, I'll reserve the judgment for the cannabis hyperemesis syndrome because I've read about it, and it seems to be that some people really believe that that's a thing. And I'm sure some people have had something like that. I certainly know that if I've had too much when it was the brownie edibles, I would get the whirlies and I wouldn't feel better until I threw up. So I don't know if that's what they're causing cannabis hyperemesis syndrome. You know, I just doubt, I don't know that that even existed, but cannabis use disorder doesn't even mean anything. I mean, there's probably some definition I should look up, but, you know, at least if they say cannabis hyperemesis, okay, all right. So somebody's throwing up, whether that's the reason or not is a good question. Let's look into that. But cannabis use disorder sounds to me like they're just labeling you a cannabis user.
Right, and that's our fear as well. So thank you for your thank you for your assessment on that. Peggy wants to follow up, and then Michael.
Something you said triggered another question. It's kind of non-cannabis related, so I'll make it brief. Since you've been in medicine for as long as you have and you've now retired, you mentioned they could change the name on it. I had a condition called complex regional pain syndrome. And to my knowledge and research, since the Civil War, they've changed the name on it 60 times already. Is this contributing to the problem of tracking data and finding reliable solutions and healthy cures to what's problematic in our society?
Yeah, what's the name of that disorder again? Because
I had complex regional pain syndrome. It's been known as reflex sympathetic dystrophy and a multiple other things.
Yeah. Yeah, well, I know that exists, and they change the names of it every once in a while. So what is your question beyond that? Again, I know that
I know that's just one medical problem out there. They've changed the name on that many times since just the Civil War. How many other things out there have they changed the name on? And it's been lost because it's hard to track down. For example, they changed the UFOs to UAPs. They do it all the time, and it makes it hard to keep track of stuff. How difficult does it make it as a physician to keep track of what you're trying to do for your patients?
Yeah, I think that's a problem. And I don't know how extensive that's a problem. I think in general, the National Library of Medicine, you know, the sort of should have some articles on that and how names get changed and stuff like that. So I don't know if there's anything there. And if you've never looked up the National Library of Medicine, PubMed is a thing to remember, just like Club Med, except PubMed. And it gets you to the National Library of Medicine, and you can put in keywords, and you can put in cannabis, you can put in, you know, all the illnesses that you saw, or you can just put in those illnesses to see what else it's been called. So it's pretty easy to access. Now, when you get into the National Library of Medicine, you'll see the titles come up, and you can even see the abstract, which is all that I ever really need to see is the abstract, meaning here's a summary of what the article says. You probably have to pay or be part of a medical center to see the whole article, but I never need that. You know, so but you can do some simple research just by looking up PubMed and seeing if any studies have been done. And it's not only studies that you see, but they'll have you know, reviews of the literature. Dr. So-and-so wanted to see how many different studies there are on complex regional pain syndrome. And there might be some thing where, you know, okay, I reviewed a bunch of these studies and this one seemed flawed, this one seemed pretty good. So you can put cannabis and complex regional pain syndrome and see specifically if anybody's done anything with cannabis, or you can just leave the cannabis out just to see all the other articles to see, you know, what they're naming them.
All right, Councilmember Crowitz.
Yeah, I just thought I'd share a couple of observations or little bits of data points of information about that hyperemesis syndrome. I had talked to Dale Geringer about that when it first came up because I couldn't find anything that was comparable to it in the literature. You know, nothing certainly before Nixon, you know, before modern cannabis prohibition. My suspicion is, and I think Dale kind of agreed with me, that it's something to do with the way we handle cannabis now versus then, either indoors under lights or the kind of, materials that we use to grow cannabis in or whatever, just a theory, but what the observation of it is a rather violent episodes of nausea and vomiting, cyclic vomiting. And it's hyperemesis syndrome if two things occur, essentially. One, if it's calmed down by a super hot shower. If all of a sudden a hot shower is about the only thing that gives you any relief from it. And one of the problematic things is people trying to use cannabis for nausea, when in fact the second thing that it's hyperemesis syndrome is if you discontinue cannabis and it stops the problem. So if you're actually using cannabis to try to treat it, when in fact removing the cannabis is the only real effective treatment, that's a problem. But we're talking about something that shows up pretty regularly when you're working in a downtown hospital of a major metropolitan city. It's probably something that a country doctor would never see in their lifetime. And even, where you were working, you probably would never see it. You'd have to see a huge volume of patients, I think, before you'd run into one. I honestly haven't ran into a single case yet, in my work. And ATN's got a couple over there in the Bay Area. So yeah, it's pretty rare, but it's a bit, like I said, hot showers and discontinuing the weed seems to give you almost 100% relief. That's a good sign. But it's definitely a Chicken Little, the sky's falling thing when you're talking about a 1 in a million problem, even now.
Even more than that. I mean, the two patients I know, one's in Colorado and the other's in Hawaii. And the other was an adult, and the other she was a teenager, and turns out to be actually a good friend of mine's daughter. So we were able to get some understanding about it. But yeah, hot showers and abstaining from cannabis are the two things that seem to help for at least them. But again, it's still a new and unique thing, whereas the discussion around cannabis use disorder, as the doctor was saying, is just a blanket what was that wonderful terminology used, a diagnosis of convenience. Thank you for that, doctor. And that wraps up our questions. So I want to thank you, Dr. Lucido, for joining us tonight. It has been an honor to share time with you, and I hope you're enjoying your retirement. Do you have anything going on or that you'd like to plug or discuss, or if people want to reach out to you, how do they get a hold of you?
Good question. It's like I hardly ever look at my emails, but sometimes I do. It's Dr. Frank, like DRFRANK at drlucido.com. So Dr. Frank at drlucido.com.
All right, so that's how to get hold of Dr. Frank. So
and you probably might want to put veterans in the title so I can do a search or something, because otherwise I don't look at my emails very often, but it'd be easier to see
I think by putting that
me.
into the column. All right, well, we'll note that and we'll pass that along. Well, thank you, Dr. Lucido. I'd also like to thank our members, Peggy Jones, Michael Krawitz, Wade Laughter, Michael Davis, Nate Landau, and myself, Etienne Fontaine. Thank you, everybody, for joining us for our V.A.C. Roundtable number 71. Dr. Frank Lucido. Thank you, everybody. Have a great one.
Bye.
You're listening to the Pace Radio Network here at paceradio.net.
The opinions of the individuals during this broadcast are their own, and may not be the opinions of their group or other organizations they may be involved with. All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
When you have a pain that's reached its peak, Legacy for 20, it's so unique. If organic cannabis is what you seek, here's your trusted partner 7 days a week. Suppository salves, vapes and drops, topicals, edibles, infused pop. Just when life seems like it ain't easy, at Legacy 420, enjoy a pop freezy. Lab tested products, make them the GOAT. Legacy 420 out on your road. Legacy 420 in Tyndonega Mohawk territory. Indigenous organic cannabis at its finest.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit, or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further, as they have professional grow lighting. They have indoor grow systems that are easy and cost effective, with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
We are people advocating cannabis education here at paceradio.net.